misinformation when it comes to breastfeeding. So we're going to offer some clarification this morning, as August is National Breastfeeding Month. Dr. Matthew Lindhardt joins us this morning from Brookwood Baptist Medical Center to talk about this. Dr. Lindhardt, good morning.
Good morning.
For a mom who I breastfed my child, it was very easy for me, but it's not easy for all women. So when we're talking about the benefits of breastfeeding, put it in perspective for us.
Sure. I'm so glad you brought up that's National Breastfeeding Awareness Month. And you may have heard kind of the term that breast is best. And that really stems from a lot of research that's gone on that shows that breast milk does have some unique benefits, including it's a complete nutrition. It does contain antibodies and other things for a growing immune system, which is incredibly important in the first little bit of life, simply because the immune system is not fully developed in newborn babies. And we can't get a lot of the immunizations during that time. And it's also really good for that bond, a special crucial bonding time for the very beginning.
And, as I mentioned, it's not easy for every mom, though. Every woman's not able to be able to breastfeed and to give the child the nutrition that they need. And that just happens for some women. It's not anything you should feel bad about. Talk about that for a moment and what your alternatives are.
Absolutely. I mean, while I did say breast is best, it's National Breastfeeding Awareness Month, but it does come with a caveat. It should be very clear that feeding your child should be a #1 priority. Feeding your child a nutrition complete formula. Everybody is in a unique situation. Breastfeeding is incredibly hard, and supporting our moms who are attempting to breastfeed is incredibly important, but also supporting our moms who choose to not breastfeed is also incredibly important. Everyone has a unique family situation, work, having to pump and deal with other children and travel and shift work and other things and that stress can really play a hard part with already the new stress of being a new mom. And so the caveat is, while we make the best and we encourage it, it really is important that we just support women and moms with whatever decision that they decide to do.
And it really has changed in recent years, making sure that women who do work, they have a place to take care of pumping and those type of things. It's more, and it sounds weird that it took this long, but it's more acceptable now. Is that fair to say?
Absolutely. I would fair to say. In fact, I find it rather unusual when there's not a special private place set aside just for moms who return back to work to have a place to privately pump and provide nutrition for their child. So it's rather unusual. In fact, there's a lot of state laws. I'm fairly new to Alabama, I'll be honest, but I know when I came from South Carolina, there were a lot of laws in place for supporting new moms and breastfeeding mothers.
All right, what are some of the misconceptions, though, that people believe about breastfeeding that you want people to know?
One of the misconceptions is you can't take birth control while breastfeeding. Other ones are if you have surgery or any type of anesthesia, you'll need to pump and dump, as they say, and you can't breastfeed your child for 24 to 48 hours. For the most part, that's entirely untrue. Most birth control is incredibly safe to take during breastfeeding. While breastfeeding does provide some partial protection against further unattended pregnancies, it is not complete. And so really even estrogen-containing birth control, which has long been touted as having a negative effect on breast milk, honestly, if you're well established, you're breastfeeding or pumping regularly, it has very minimal effect. And we actually, most OB-GYNs feel we do need, if you want to protect yourself, if you don't want another pregnancy so soon, you should be on birth control.
So what is the recommended time now today to breastfeed your child, to continue with breastfeeding?
Just came out with their recommendation for up to 2 years, which can sound rather daunting. The World Health Organization has said that 1 year should be a goal. Most of the time I tell my patients, focus on small goals. If you really want a desire to breastfeed, that first 6 weeks is so crucial for the bonding, for that immune system, for that complete nutrition. And then after that, take it as a day by